Many seniors take blood pressure medicine every day, but here's a question people rarely stop to ask. Which medication is actually safer for older adults, lisinopril or losartan? Both are widely prescribed. Both help protect the heart and kidneys. Yet for seniors, the risks and benefits can look very different. And the answer may not be what most people expect. Before we continue, a quick reminder. This video is for education only. It is not medical advice. Always speak with your doctor before making any changes to your medication. In the next few minutes, we'll compare these two drugs side by side. You'll learn how each one lowers blood pressure, which side effects matter most in seniors, what the latest medical guidelines recommend, and ultimately, which medicine doctors often consider the safer choice. Stay with me, because the safer option isn't always the most popular one. Lisinopril and losartan both lower blood pressure, but they work in different ways. Lisinopril belongs to a group called ACE inhibitors. It works by blocking a chemical that tightens blood vessels. As the vessels relax, blood flows more easily and blood pressure falls. For seniors, this can be especially helpful because lowering pressure reduces the risk of stroke, heart attack, and kidney damage. Studies also show lisinopril may help protect the kidneys in people with diabetes or chronic kidney disease. That's one reason many doctors consider it a strong first-line option for hypertension. Here's the practical side. Most adults start at 10 mg once daily, but seniors often begin lower, around 2.5 to 5 mg, especially if kidney function is reduced or if they take diuretics. Doctors then raise the dose gradually, usually every 1 to 2 weeks, until blood pressure is controlled. The maximum daily dose can reach 40 mg, but older adults rarely need the highest amounts. Losartan works differently. It belongs to a class called ARBs, angiotensin receptor blockers. Instead of blocking the production of the tightening chemical, it blocks the receptors where the chemical acts. The end result is similar. Blood vessels relax, pressure drops, and the heart doesn't have to work as hard. For seniors who cannot tolerate ACE inhibitors, losartan is often the preferred alternative. It also has strong evidence for protecting the kidneys and reducing stroke risk in patients with hypertension. The dosage is different as well. In younger adults, doctors may start at 50 mg daily, but for seniors, especially those with liver problems or dehydration risk, the starting dose is often 25 mg. If needed, the dose can be increased gradually up to 100 mg a day. And here's the important point. Like lisinopril, losartan should never be adjusted suddenly without medical guidance because blood pressure can become unstable. So when it comes to effectiveness, both drugs are proven. Lisinopril blocks the formation of a vessel-tightening hormone. Losartan blocks its action. And for seniors, the decision depends on more than simply lowering blood pressure. Every medication comes with side effects, and in seniors, these effects are often stronger or more noticeable. Let's start with lisinopril. The most common problem is a dry, persistent cough. Some people describe it as mild irritation. Others say it becomes disruptive, especially at night. This cough can appear weeks or even months after starting treatment. Another issue is dizziness, especially when standing up quickly. Because the medicine lowers pressure by relaxing vessels, some seniors may feel lightheaded, particularly during the first few weeks. Lisinopril can also raise potassium levels and sometimes strain kidney function, especially in older adults who are dehydrated or already have kidney disease. That's why doctors regularly check blood tests after starting or increasing the dose. And here's the key. These side effects are often manageable when the medicine is started slowly and monitored carefully. So when it comes to effectiveness, both drugs are proven. Lisinopril blocks the formation of a vessel-tightening hormone. Losartan blocks its action. And for seniors, the decision depends on more than simply lowering blood pressure. Every medication comes with side effects, and in seniors, these effects are often stronger or more noticeable. Let's start with lisinopril. The most common problem is a dry, persistent cough. Some people describe it as mild irritation. Others say it becomes disruptive, especially at night. This cough can appear weeks or even months after starting treatment. Another issue is dizziness, especially when standing up quickly. Because the medicine lowers pressure by relaxing vessels, some seniors may feel lightheaded, particularly during the first few weeks. Lisinopril can also raise potassium levels and sometimes strain kidney function, especially in older adults who are dehydrated or already have kidney disease. That's why doctors regularly check blood tests after starting or increasing the dose. And here's the key. These side effects are often manageable when the medicine is started slowly and monitored carefully.
For most seniors, Lisinopril and Losartan are considered safe under medical supervision, but both carry some rare, more serious risks worth understanding. Lisinopril can very rarely trigger a dangerous allergic reaction called angioedema. This causes swelling of the lips, tongue, or throat and can become life-threatening if breathing is affected. While uncommon, the risk is higher in some older adults and requires immediate medical attention. Losartan generally has a lower risk of angioedema, which is one reason some doctors prefer it in patients who experienced cough or swelling from ACE inhibitors. However, Losartan can still contribute to dehydration or kidney stress, especially during illnesses involving vomiting, diarrhea, or poor fluid intake. Here's the surprising part. Both medicines can increase fall risk in seniors, not because they slow the heart, but because they may lower blood pressure too much. When blood pressure drops suddenly after standing, dizziness or fainting can happen. And for older adults, even one fall can lead to hospitalization or loss of independence. The bottom line, neither drug should be feared, but both require careful monitoring, especially in seniors taking several medications or living with kidney disease. Regular checkups, blood pressure tracking, and blood tests help keep treatment safe. For many seniors, one of the biggest challenges isn't taking a single medicine, it's taking many medicines together. Doctors call this polypharmacy, and it changes the safety picture for both lisinopril and losartan. Lisinopril can interact with diuretics, anti-inflammatory pain medicines like ibuprofen, and potassium supplements. These combinations may increase the risk of kidney strain or dangerously high potassium levels. In older adults already managing several prescriptions, these interactions matter more than many people realize. Losartan also brings interaction risks. Combining it with certain water pills, potassium products, or other blood pressure medications can lower blood pressure too much or affect kidney function. Even over-the-counter supplements can change how safely these medicines work. Now, doctors do sometimes combine these drugs with other blood pressure medications for better control, but in seniors, this is usually done carefully and with lower starting doses. The goal is to balance effectiveness while reducing side effects and fall risk. Here's the part many older adults never hear. Polypharmacy itself is a major health concern. Even safe medications can become risky when several are layered together. That's why medication reviews every few months are extremely important for seniors. And this brings us to the next question. What do major medical guidelines actually say about these drugs in older adults? That's where we'll turn next. When doctors choose a blood pressure medicine for seniors, they rely on recommendations from expert groups like the American College of Cardiology and the American Heart Association. Most guidelines agree that treatment goals should be individualized. Healthy seniors may benefit from lower blood pressure targets, while frail older adults often need more cautious treatment. Both lisinopril and losartan are considered effective first-line options for hypertension. They are especially useful in seniors with diabetes, chronic kidney disease, or heart failure because of their protective effects on the heart and kidneys. Here's the important distinction. Lisinopril has been used longer and has extensive long-term evidence. Losartan is often preferred when a patient develops ACE inhibitor cough or cannot tolerate lisinopril. In practice, many doctors start with one and switch if side effects become a problem. The guidelines don't declare one medicine universally safer. Instead, they emphasize tailoring treatment to the individual's overall health, kidney function, and side effect profile. That's the key principle doctors follow in older adults. And this leads to a practical question. Between lisinopril and losartan, which one is actually prescribed more often for seniors, and why? In real-world practice, both medicines are extremely common, but losartan has become increasingly popular in older adults. Why? mainly because it tends to cause fewer bothersome side effects, especially cough. Many seniors stay on losartan longer simply because they tolerate it better day to day. Lisinopril, however, remains widely prescribed because it is effective, affordable, and strongly supported by decades of research. For seniors who tolerate it well, it remains an excellent treatment choice. Here's the key difference. Lisinopril is often chosen first because of its long track record and strong cardiovascular protection. Losartan is frequently selected when tolerability and comfort become a bigger concern, so if you ask which medicine is safer, the answer depends on the patient's health history and how well they handle side effects. And that brings us to the final comparison. We've looked at effectiveness, side effects, serious risks, interactions, and guidelines. Now it's time to put it all together. So, how do these two medicines compare in seniors? Think of lisinopril as a blood vessel and kidney protection medicine. It lowers blood pressure effectively and has strong evidence for protecting the heart and kidneys. That's why it's often one of the first medications doctors prescribe. Now think of losartan as a gentler alternative with similar benefits. It also protects the heart and kidneys, but is less likely to cause cough or throat swelling. That's why many seniors find it easier to tolerate long-term. Both medicines can cause dizziness, both can affect kidney function and potassium levels, and both require careful monitoring. But their side effect patterns are different. Lisinopril is more likely to cause cough and rare swelling reactions. Losartan is more likely to be chosen when those issues appear. Here's the takeaway. Neither medicine is automatically safer for every senior. The best choice depends on overall health, kidney function, other medications, and tolerance. And in every case, regular follow-up is what keeps treatment safe. Before we close, one final reminder. This video is for education only. Never stop or change your medication without speaking to your doctor first. If you found this useful, give it a thumbs up, subscribe to MedDose Explained, and stay with us, because in our next video, we'll cover the warning signs that your blood pressure medicine may be too strong, and it's something every senior should know.